Dr. Sadler with Creating Future Nurses, and today we're going to talk about fluid volume deficit. So, fluid volume deficit, that's another way of saying dehydration. Your patient might be dehydrated, right? So, let's think about when we talk about fluids, what are some ways we take in fluids? We take in fluids by drinking them, obviously, but also by eating. Your fruits. Your fruits have a lot of water, so eating fruits can, cause you to take in water. But other ways, maybe we have IV fluids, maybe we have parenteral nutrition, maybe we're getting fluids through a PEG tube or G tube of some sort. Now, how do we lose fluids? We lose fluids through a variety of ways. For example, when we urinate, we lose fluid. Also, vomiting, diarrhea, these are all ways we're losing fluids. And so you have to, keep those things in mind. Now, we have some insensible fluid losses and some sensible fluid losses. Our insensible fluid losses are things that we can't measure. So sweating, we lose fluid that way, but we can't measure it. Also, when we're talking, we lose fluid, but we can't measure that either. So those are considered insensible fluid losses. Sensible fluid losses are things that we can measure. So when we urinate, if we have diarrhea, if we're vomiting, if we have a drainage attached, maybe we have a Jackson Pratt or some type of drainage attached, we can measure those things. So those are considered sensible fluid losses. So when we talk about fluid volume deficit, we're either A, we're not taking in enough fluid, or B, we're losing too much fluid in the body. So things that will cause us to not take in enough fluid. What if we've had dysphagia? So dysphagia is difficulty swallowing. So if we have difficulty swallowing, we're not going to be able to take in enough fluids because we're choking every time we're trying to swallow. And so then what do? We tend to not drink or eat because we don't want to have those choking issues. Impaired swallowing as well as extreme weakness. So a person that's extremely weak is not going to be able to take in enough fluids either because they're too weak to take in those fluids. Disorientation. So you might say, why disorientation? Think about your dementia patients. Your dementia patients are going to probably forget to drink enough. So if we're not encouraging them to drink, they will likely forget to drink and not take in enough fluids, which can then put them at risk for fluid volume deficit. And no access to water. Obviously, if we don't have access to water, we can't take in the proper fluids that we need to take in to maintain our body. Now, patients who lose excessive fluids are also at risk for fluid volume deficit. So again, like we said, vomiting and diarrhea, you're losing fluids. So if you have excessive vomiting or excessive diarrhea, now if you just have one episode of vomiting, you're probably not going to go into fluid volume deficit. But if you have excessive vomiting or excessive diarrhea, you're going to be losing fluid constantly. And if you're not replacing those fluids like you need to, then you're going to be at risk for fluid volume deficit. Hemorrhaging. Hemorrhaging is just excessive bleeding, right? So if you had some type of trauma, a gunshot wound, a stab, or any other type trauma that's causing you to hemorrhage and you're losing blood, you're losing fluid. And so that also is going to put you at risk for fluid volume deficit. Diaphoresis, that's excessive sweating. So sometimes when we're sick, we're sweating a lot, especially if we have a fever or something like that, we're sweating a lot. So if we have excessive sweating or diaphoresis, then we're at risk for fluid volume deficit also. And sometimes some of our wounds, especially our stage 4 wounds, may be draining quite a bit. And if they're draining an excessive amount and we're not replacing those fluids like we need to, then again, your patient is at risk for fluid volume deficit. Now, if you know that your patient has one of these things, you want to make sure you're putting things in place to try to prevent fluid volume deficit from occurring. But obviously, we can't always prevent it. And so we need to be making sure we're monitoring for signs and symptoms of fluid volume deficit. So some signs and symptoms might be excessive thirst. They might be excessively thirsty, or weak and dizzy, right? So when we talk about weakness and dizziness, that will lead us into something even more, because there are risks for fall. So then we need to also make sure we're putting fall precautions in place. So you got to think about all those things. Although we're talking about fluid volume deficit, we still got to look at safety as an issue too, because if they're weak and dizzy, decreased urine output, they don't have the fluid in them to release. So their urine output would be decreased. Decreased blood pressure. I want you to always remember the blood pressure will follow the fluid volume in the body. So if the fluid volume in the body is decreased, then the blood pressure will follow along and decrease as well. You're going to be dry. So you'll have dry, cracked lips, dry mucous membranes, because your body is just going to be dried out. Concentrated urine. So your urine is going to be dark and concentrated as well as a result of fluid volume deficit. Thick saliva. Can be an indication. Poor skin turgor. Skin turgor is when we pull the skin up. It usually has some elasticity and bounce back pretty quickly. Now, a person with dehydration, it's not going to bounce back as quickly. And so we call that poor skin turgor or delayed skin turgor. Flat neck veins. Flat neck veins are an indication of fluid volume deficit. Their heart rate's going to be increased, and it's going to be weak and thready. They could possibly also have an increase in their temperature as well. And decreased weight. If you're losing a lot of fluid, then you could be losing weight as well. So these are going to all be some signs and symptoms that your patient may be dehydrated or have fluid volume deficit. Now, if you notice that your patient is experiencing some of these signs and symptoms, then we need to take proper actions to get some things in place for them. Obviously, they're going to need an increase in their fluid intake. When we talk about our nursing interventions, so what are going to be your nursing interventions and or anticipated treatments for this patient? Increase in their fluid intake, obviously, because the issue is their fluid volume is decreased. So we need to increase their fluid intake. Now, depending on the severity of that fluid volume deficit, just taking in oral fluids may not be enough for your patient to recover. And so they may need some IV fluids ordered as well to help with that. Obviously, we're also going to monitor fluid and electrolytes, because yes, our electrolytes will be off as well if we have alterations in our fluid volumes in the body. Monitoring our vital signs, because remember we said the blood pressure is going to be decreased, the heart rate is going to be increased, and they could possibly have a temperature as well. So we want to make sure we're monitoring our patients' vital signs, because if we're putting our interventions in place with the increase in the fluids and whatnot, then their vital signs should be coming back to normal. Same thing with electrolytes, should be coming back to normal as well once we put our interventions in place. A decrease in fluid loss. So remember we said vomiting, diarrhea, hemorrhaging, all those things are fluid loss. So if we have excessive fluid loss, then we need to put some interventions in place to stop that fluid loss. So if it's vomiting, then we're going to do the antiemetics. If it's diarrhea, we'll do the antidiarrheals. Or if it's a particular disease that's causing us to have vomiting and diarrhea, we need to address that disease as well so that we can stop the vomiting and the diarrhea. If it's hemorrhaging, obviously we need to stop the bleeding from wherever it's occurring. Because if we continue to have fluid loss, then that dehydration is going to worsen, and our patients' signs and symptoms will worsen as well. We want to monitor their weight, because remember we said their weight is going to decrease. So we want to monitor their weight. Now when you're monitoring a patient's weight, you're doing daily weights because of fluid volume imbalances. You want to check that weight every morning, same time in the morning before they eat, after they urinate, same amount of clothes, and if possible the same scale, so that we can get an accurate weight on that person to determine, are they continuing to lose weight or what's going on with that. So we want to continue to monitor that appropriately. And then monitoring INOs, monitoring intake and output. What they're putting in should be comparable to what they're putting out. So we need to be monitoring that. Sometimes, especially if our patients are incontinent, we may need to put in a Foley catheter or something so that we can properly monitor those patient's output, right? Because if they're incontinent, it'd be kind of difficult to monitor that. So you got to keep that in mind as well. So these are all some of our indications for a patient with fluid volume deficit. So our risk, signs and symptoms, and our nursing interventions. Keep that in mind. Like I said, when you get to your med-surg, you have different diseases. We didn't talk about that. Some of the diseases that can cause fluid volume deficit, such as your diabetes insipidus or some of those other diseases. Just remember, and sometimes people get caught up on the disease itself. If that disease causes fluid volume deficit, then your signs and symptoms are going to be the same. You're still going to have, all these same issues. So don't forget your fundamentals. So thank you guys for watching. If you enjoyed this video and would like to see some more videos like this, why don't you please consider subscribing to my YouTube channel so that you can get the latest updates on the videos that we're producing.